You're just invisible. You go in and you state your problem, and the next thing you know, you're completely invisible.
If anyone in my family wants appointments for doctor, I ring to the doctor and get appointments for them. And when you ring the reception, and on the reception they say, sorry, all doctors are busy. They're all busy. It's all booked. Ring back another day.
The appointment thing, if you ever have to phone at 8 o'clock in the morning, that is an absolute nightmare situation. And you can phone and phone and phone and phone and phone, and the phone's engaged till maybe 11 o'clock in the morning to our surgery. So I try and avoid that if I can, but I realise that some people, you know, if you are a working person, it's very, very difficult that.
Having appointments that are easier to access for a young person, because, like, to be fair, most of the appointments are during the day, and when you're a young person, you're at school, college, uni, or even if you're at work, like, you'll get a few evening appointments, and if you're lucky, you'll get a few evening appointments. So, like, you need appointments for young people, like, that will suit them.
The worst thing I've found, or I've heard as well, is getting past the receptionist on a GP. Some people some receptionists ask what's wrong with you, and some older people especially don't feel comfortable with this. The other thing is actually getting hold of the receptionist and being put on hold, or sometimes it can be about 20 minutes. It's very difficult. Once you get there, there's a login system where you can press a button, put your first initial, and off you go. But that's a good thing in some cases, but some older people don't know how to work, so they get a little bit flustered. And then when they get to the reception, they'll say, why didn't you use a login system? So, well, I don't know how to use it.
Normally, when I go to the doctors, my mum books the appointments, but when I get to the actual doctor's surgery, it's easy enough because they've got one of the touch screen things where you basically just put the initial of your surname and your date of birth, and then it registers who you are.
And it's like, even with, like, the PPGs that are going on, they're all in school times, so, like, you've just ruled out young people altogether. You've just ruled them out completely. Like, at 9 AM on a Thursday, how is any young person going to actually manage that? So I think they need to, like, how would you take young people into account more?
I am very conscious of the fact that I have a short time, but I always have some sort of a personal discussion with my doctor when I go as well. There's always that, he always allows me that moment of time, and it makes it easy because I could talk to him about anything and everything, because we now have that kind of relationship.
Once I went in and I started sort of, like, feel slightly more faint, and I think it was my anxiety just getting worse, and, like, sort of, like, different type of panic attacks and things. And my GP used this massive word that I had never heard of, and I didn't even know what it meant. And then basically he said to me, once you fainted, then come back to me, kind of thing. And so I was just absolutely horrified. And then afterwards, I asked my mum what that word meant, and she said it meant you're having panic attacks. And I was like, I already know that. He doesn't have to tell me that in a word that just completely confuses me.
We felt that my husband's loss of memory was impinging on my son's mental health, and so we made arrangements to have checks made on my husband's condition. I was flabbergasted that when I tried diplomatically, if you imagine, with a person with short-term memory loss, considerable short-term memory loss, goes to the doctor without knowing why they're going to the doctor, then the carer goes with them. But if the carer is not listened to, and the carer is told that the memory loss is par for the course, and you just better get on with it and get used to it. That is not supportive. Then when the GP points to the door and says, the sign on that door is doctor, not marriage guidance, that is also far from supportive. And then when the GP further says, do you realise that your son is the most seriously mental ill patient we have on our books? That is not supportive. And then he gives him a label. And labels are not supportive.
I had a different experience in a different surgery before I came to this one. I went in with a very bad throat, and it's something I don't suffer from at all, so otherwise I wouldn't have gone. If it was something I would just deal with it myself. But because I didn't have that kind of situation, I went to the doctor, went in. He was working at his desk on the computer. He never looked up. He said, "It's Mrs. Whelan, isn't it?" I said, "Yes." He never looked up and he was typing it all away. He said, "What's the problem?" I said, "Got a really, really bad throat." And I said, "It's something I don't suffer from, so I just thought I'd come and get something." And he just scribbled on a prescription and passed it to me, and he never looked. So as I went out the door, I said, "Well, and have a lovely day, and it's been absolutely lovely talking to you. Thank you very much." But I didn't think he felt very abashed. But that was completely the other end of the spectrum.
And the doctor doesn't treat you as a person. He treats you, oh, you're the cough, you're the cold. If you've got a catalogue of complaints, oh, I can only treat one of them. Which one do you want me to treat? Well, I want you to treat me as a person, as a whole. Because I don't know which symptoms are worse. You know, that's why I'm telling you everything. Okay.
And I think if you're in a practice whereby there may be 7 or 8 doctors, and then you've got that opportunity to see all those people. Now, if it's not a serious thing or you're not going with the same illness, that doesn't matter if they're good, are they? It doesn't matter to me. Well, to me personally, it doesn't matter.
You go, so you don't know which doctor you're seeing. It's a locum. There's a lot of locum doctors out, and very good they are, some of them. Some not so good, like ringing for reception to come in. I can't get this form up. Right, you do it like this. I can't get this form up. Back in again. And I know receptionists say confidential, but I'm in there and they're talking, and she can identify a person with this file and think, oh, I didn't know he had that, I didn't know he had this, oh, I didn't know. It's embarrassing.
And I've made a little list here of the things that I feel GPs need to do in order to help people with mental health problems. And while we know that 1 in 3 people get a cancer diagnosis, and that's moving to 1 in 2, 1 in 4 people in the UK will experience a mental health problem at some time during their lives and go to a GP. And I don't believe that GPs have fully taken this on board. My feelings are this: update your knowledge, or some of you in the practice, update your knowledge on mental health issues. Listen to the patients and carers. Please listen to them, because they're the people at the sharp end who know what's happening outside the surgery. Don't allow your preconceptions to cloud your understanding. Preconceptions and old knowledge don't help you understand what's going on for the patient and the carers. And finally, give hope. That is one of the most important things that a GP can give. And that is hope that somebody who's going through a very rough time at the moment, it will improve. With support and help, it will improve.
You know, if you do have mental health problems, and I do, sometimes just reassurance is what you do. But sometimes you go in and they say, oh right, yeah, well, in so-and-so taking care of that. It could be a therapist. Well, yeah, sort of. But I want to talk about this medication I'm on. Can I reduce it? Ooh, no, not till she says. I want to, she didn't prescribe it, you did. She won't take me off it because you prescribed it. So you're caught between two places then. And you do get the feeling that sometimes it's just, you're on a treadmill and all they want to do is, you're in, you've done, and you've gone. And you just get the feeling that, oh, I'm really sorry for disturbing your day.
No matter how hard my mum has tried to make them talk to me, then I'm still even visible when they're saying, like, oh, unless you want to explain, and then, like, no, but they're completely blanking me, they're sort of looking at my mum. They just treat you like you're invisible.